All right. They have not taken the COVID shot, but they will be able to shoot their shots on the basketball court or other sports and entertainment arenas.
Yeah, that is because Mayor Eric Adams has announced a change to the city's private sector vaccine mandate, allowing athletes like Kyrie Irving and players on the Yankees and Mets to play at home games. Mayor Adams says that he is extending a loophole that already allowed unvaccinated visiting athletes and performers to work in New York, but this now applies to the home team as well. Critics are saying this is special treatment for celebrities.
Joining us right now, former senior advisor for public health to Mayor de Blasio and director of the Center for Pandemic Prevention and Response at Weill Cornell Medicine, Dr. J. Varma. Nice to have you in the studio.
Yeah, it's great to be here in person finally.
So what's the problem with this exemption? Why are you against this?
So, you know, I'm a big advocate for vaccination, and one of the major actions that the former mayor took when I was advising him was to require anybody who works for any company in New York to get vaccinated. Creating an exemption has two problems. First of all, legally, right? Anytime you carve out a group, you have to have a justification for why you're carving them out. And it can't be one based on we want our teams to win. So there's a legal challenge here that might throw out the entire rule.
What the mayor is saying on that is we allow visiting players who are unvaccinated to play in our arenas. So why not let our teams play?
Well, New York City only has the legal authority to make rules for employers based in New York. So it's the same reason why if you pay for the LA Lakers, you don't have to pay New York City taxes, right? So we have one tax rule, like if you live in the city. So our athletes are already under restrictions, right? You know, some athletes, Tyreek Hill didn't want to sign for the Jets because, you know, he's got to pay more taxes here than in Florida. So there are rules that sometimes only apply to people who live in New York. That's one of them. And the second big concern is the message it sends, right? You know, part of the reason we can fight COVID is everybody feels at least some responsibility, not just to themselves, but to everybody else, right? And if you say one group, well, we're not all in this together, we're kind of on our own, I do think that is a real threat to the way public works.
The numbers are going down, okay? Should we not be treating this like a cold and flu right now?
So here's the big concern. New York is a much more vulnerable place than anywhere else is. Why? We're more connected to the rest of the world. We have the highest population density. It's the reason COVID at first, you know, I was here during Ebola. Things come here first, so we have to be a little bit more careful. It's why we have a strong anti-terrorism force here that maybe another city doesn't. So I just think until we know that this virus is going to be done mutating into more dangerous forms, I prefer a more cautious approach. It doesn't mean wearing masks, but things like vaccines that protect everybody and last a long time, those are sacrifices we can all make.
But the problem is that you don't know when it's going to stop mutating. Like, this may be something you continue with forever. So you can't keep those measures there forever, correct?
Well, we do have vaccines that we continue to use forever too, right? And so I'll give you a perfect example. So polio is the most classic example, right? Vaccine became available in the 1950s. Everybody still gets polio shots. When was the last time there was a case of polio in the U.S.? Long, long time ago. But the virus is still evolving. And so now there's new strains that are coming up. So it is possible we may have to get vaccinated forever, but that's something we've already adjusted to in our lives.
But the problem is with these vaccines, you get one shot, you get vaccinated, you can still get COVID second time, third time, get a booster shot, still get COVID second time, a third time.
We got it.
Yeah, that's the issue that we're talking with.
So I think this gets to the fundamental messaging problem that we in public health have had is the reason we give vaccines is to prevent severe illness. That
For
is
yourself.
Yes, but it also does reduce the risk that you'll transmit to other people. That's important. It's not as strong as we would like it to be, but it is work. But the other thing is hospitals are a shared resource. Okay, we don't have an unlimited number of doctors and nurses and staff and beds. It's a shared resource. So we all have to do our part to reduce the demand on hospitals. If your hospital has to surge every 3 months like it's doing, when you're delivering a baby or you get in a car accident, I'm sorry to tell you, your hospital's not going to be as well prepared as it would be if we had fewer COVID cases.
So we're hearing a lot of people getting it, right? Hillary Clinton, Jen Psaki, who works for the president, friends of ours. I know about 10 people who got it. Very mild cases. They've been home tested. I guess the city has no idea how many people have it right now because people are getting home tested. How do you track that?
Yeah. That is difficult, and that's actually one of the challenges that we also face, is that because a lot of people are getting tested at home, which is a good thing, I'm a huge advocate of it, it does make it a little bit more difficult. You know, in public health, we have to take imperfect information and put it into a mosaic and make decisions. It's the same thing that, like, intelligence agencies do. They're trying to figure out, okay, is there a threat You know, you never have perfect information, but you have pretty good information, and that's what we're using right now.
We have a part of an interview with Mayor Adams about why he wanted this exemption. Let's listen.
We're talking about a small number of people that's having a major impact on our economy. There's a duality to what I must accomplish. I must accomplish keeping the city safe, and I must accomplish recovering our economy.
Well, he's got a point. I mean, because New York City is, as you know, in the toilet compared to other cities as far as bouncing back with a... We got to move forward here.
Oh, I agree completely. You know, I am in favor of doing things that represent, you know, a path forward for the city. But let's be realistic about what that means. The Nets have Kevin Durant, okay? They're not having any trouble, I think. I live 5 minutes from Barclays Center. That place does not look empty to me. I'm sorry. Vaccine requirements are something that every athlete had to get to play high school and college ball, okay? This is not some unusual or strange thing. So let's be realistic here. People have had to do this, and they do it for the sake of everybody else.
Well, can we unpack it a little bit more just in terms of what his, I guess, reasoning was for this? Because when you look at the timing, it's kind of ironic. The Nets going into playoffs, opening day coming up April 7th, and the fact that Steve Cohen donated $1.5 million to back Eric Adams in the primary, it's just like this is all getting a little too weird.
Well, and for people like myself, the reason this is such a problem is it's already hard enough, because you're asking very, excellent questions. Why am I still getting infected? So it's hard for us to communicate complex information and to build that trust. When that trust ends up being, well, you said this is science, it applies to everybody, how come it doesn't apply to them?
Yeah.
It makes my job and other people, health experts, harder. And that's one of the reasons, I love sports. I'm a massive sports fan. But I just want the rules to apply to everybody.
Hey, Doc, have you heard about these apps the kids are using? They fake their vaccine.
Oh, so they can...
Oh, and apparently it works.
Yeah. I mean, there's always going to be people in society. Look, people use fake IDs to get into bars and stuff.
Yeah.
The reality is, no matter what you do in public health, you're not looking, you dream of 100%, you're never going to get 100%.
Yeah.
But if you can get a large percentage, and let's remember, 95% of adults in New York City, that's an extraordinary number, have gotten at least one dose of the vaccine. There's no reason Aaron Judge, Kyrie Irving, and the other athletes...
But you know they're not going to do it.
I don't actually know that. Believe it or not, the reason vaccine mandates were, everybody said that about city employees, right? What happened at the end? People were still getting their shots up until the moment they were able to get there. And that's why vaccine rules work.
Over 1,000 people lost their job in the city. But when do we treat COVID like the flu? We don't mandate the flu vaccine. We encourage it.
Correct, but did the flu, this is the challenge here, okay? If there had been a situation in which the flu was killing tens of thousands of New Yorkers,
and it does. It does.
Well, it doesn't in one big surge, and that's really the difference here, right? Okay, it causes deaths, but over an extended period of time. You don't get into situations like we had with Omicron, where you literally cannot get care for other medical problems because of this disease, and that is the challenge here. And let's also not forget, the chronic symptoms of this disease in some people are really, really extreme. We just don't know enough yet, okay? It is very likely that within 1 year, 2 years, somewhere in the very near future, we're going to be at a point where our vaccines work really well, there's enough immunity built up both from infections and from vaccinations, and the virus is stabilized, that we can get back to that stage.
We look forward to it. Dr. J. Varma,
I do too as well.
the director of the Center for Pandemic Prevention and Response at Weill Cornell Medicine. Thank you so much.
All right.